So, how do you approach the mental health crisis that we've been experiencing with teens? I recently spoke to a pediatrician who told me that he was fearful if he acted outside the bounds of those guidelines, that if something would happen, unfortunately, to that teenager, that his license would be at risk. And that was an answer to a question I had regarding the safety of antidepressants, since they more than double the risk of a suicide event for a teenager. Why would we be prescribing them for someone who is presenting as suicidal? So I'm curious to know how you navigate that.
I'm just blessed and lucky. I fear God more than I fear the AAP and like the pediatric board. So I just um, I'm trying to DGAF what they would do to me. Like I'm not going to poison kids and violate God's law and my conscience. Um, how I approach it, I was thinking of this as I prepared. I wanted, if I can, tell you all a story of a young lady. This was not a patient of mine. But this was a real woman. She was a princess. Her dad was a king of Hungary. The entire country had incredible wealth and power. And his daughter, the princess, could have had a life that would have made, even Meghan Markle jealous, and incredible luxury. And what did she do? She gave it all away. She sold all her jewelry, gave the money to the poor. She built a hospital and didn't just run it like an administrator, but she was in there among the sick and the dying, cleaning their wounds, washing their feet. The children, if they would have to be alone in the hospital at night, she wouldn't allow that. She'd come have them sleep in her bed with her so she could take care of them, take them to the bathroom overnight. She loved them. She poured out love and caring on these people, on these poor, suffering people. And that was Elizabeth of Hungary, Saint Elizabeth, and this was like in the 1200s. And if you asked her, like, on the PHQ-9, are you happy? Are you sad? What's your rate? 1 to 5, like your contentment for that. Like it wouldn't even enter her mind because that's not how people used to think, and that's certainly not how the saints we used to teach our children about used to think. It's about others. It's about serving and laying your life down for others because that's what God did for us. And so, how do I approach this mental health crisis of today? I think it's pretty inevitable. I mean, we're living in an unprecedented culture, the first one in the history of the world that doesn't have a foundation of sacredness to it. And where instead of having meaning in the world, meaning that comes out from outside of us, that we participate in, we're all told to kind of make our own meaning, invent ourselves, invent purpose. And of course, that's not going to work. It's never worked before. And so people are falling apart. And so I'm just trying to do the best I can. I can't do it for everyone. And it's not really up to me, but of just trying to point families and patients and readers back to the source of truth and goodness and joy. One of the problems we have right now is, and not like to insult you or any, it's just part of the profession. It's like we talk about happiness and happiness. It's not about happiness. Happiness is fleeting. It's superficial. It's about joy. Happiness is to joy. It's like optimism is to hope. I mean, optimism, okay, it's good to see the glass half full, whatever, but that's not going to be worth much. You need hope. That's something which a firm assurance on some solid ground that you can stand on. And you need joy, not happiness. I don't know if Elizabeth of Hungary was happy, but she was filled with joy. And her only regret, towards her dying days was that she said, I wish I could have done more to help other people. That was a princess who tried her best to live like a pauper. And today, instead, we have a bunch of, paupers who just are jealous of these social media princesses and want to live like them. Our whole worldview has been turned on its head. And I'm just trying to point people back to God who turned it the other way again.